Have you ever thought about the life of a nurse in India? Let's delve into that. Nurses, the lifeline of our healthcare system, are the unsung heroes who weave the fabric of patient care. Their expertise spans from administering medication to assisting in critical surgeries, and their importance cannot be overstated. They are the first line of comfort for the ailing, the first ray of hope in distress. But the nursing profession in India is not a monolith. It's a tapestry of roles and responsibilities, from staff nurses who shoulder the primary care duties to nursing superintendents who manage and oversee nursing services in hospitals. There are also specialized nurses like pediatric and cardiac care nurses, each playing a unique role, each essential to the functioning of our healthcare system. These are the unseen heroes, skilled and tireless, ensuring the well-being of countless patients day in and day out. They are the silent guardians, the watchful protectors of health. Yet, despite their indispensable role, they're often undervalued and underpaid. Now, let's dive into the reality of their struggles. In the heart of India's healthcare sector, nurses grapple with a myriad of challenges on a daily basis. They are the unsung heroes, often overshadowed by the more visible roles in healthcare, yet their contribution is indispensable. But what's the cost of their commitment? Pay disparity, for one, is a persistent issue. Despite their vital role, nurses often find themselves on the lower end of the pay scale. This is further aggravated by low healthcare budgets, which inevitably translate to lower wages for these frontline workers. The situation is particularly dire in private hospitals and nursing homes, where violations of minimum pay standards are unfortunately all too common. The strain doesn't stop at their wallets. Nurses in India also face an increased workload, often performing duties beyond their job description. This not only compromises their well-being, but also stretches their work hours, making their schedules erratic and unpredictable. But it's not just about the physical toll. The emotional and psychological impact is equally significant. Instances of sexual harassment are not unheard of, creating an environment of fear and discomfort. The power dynamics in the workplace often deter these nurses from reporting such incidents for fear of backlash or job loss. Yet the spirit of these nurses remains unbroken. They continue to serve, to care, and to heal even in the face of adversity. However, the harsh realities they confront daily compel many to consider other options. Better compensation and working conditions abroad become tempting prospects, contributing to the brain drain that further exacerbates the worldwide shortage of nurses. Many are forced to consider working abroad for better compensation, exacerbating the worldwide shortage of nurses. But there's hope. Proposed guidelines from the Ministry of Health and Family Welfare could improve their working conditions. These guidelines aim to address the pressing issues nurses face in India. They propose better wages, ensuring a fair pay for the tireless work nurses do. They also propose a safer work environment, free from harassment and exploitation. Moreover, the guidelines call for reasonable work hours, allowing nurses the rest they need to provide the best care possible. So, why haven't these changes been implemented yet? The main reasons are twofold. First, a lack of political will, and second, the low healthcare budgets that are prevalent in India. Both of these factors contribute to the slow implementation of these much-needed changes. The potential improvements these changes could bring about are immense. Nurses would not only receive better compensation for their work, but they would also enjoy a safer and more respectful work environment. This could also help to address the worldwide shortage of nurses, as better working conditions could make the profession more attractive. However, these proposals remain on paper, and their realization is a distant dream. You might be wondering, what can I do? Well, there are several ways you can contribute to improving conditions for our nurses. First, You can advocate for the implementation of the proposed guidelines by the Ministry of Health and Family Welfare. These guidelines aim to enhance the working conditions of nurses, ensuring they're treated with the respect they deserve. You can also help by raising awareness about the challenges that nurses face. Share stories, start conversations, and underscore the importance of their role in healthcare. Remember, awareness is the first step towards change. Consider supporting organizations that work tirelessly to improve conditions for nurses. These organizations strive to ensure fair pay, safe work environments, and the recognition of the invaluable work these healthcare professionals do. Lastly, let's not forget the power of gratitude. Show appreciation to the nurses you encounter in your life. A simple thank you can go a long way in making them feel valued. Join us in supporting better treatment for our nurses. They are the unseen heroes of our healthcare system, and it's time we acknowledge their worth.